Okay guys, so we hit our 16-minute time frame again. So I just want to show you, I'm just setting up my IV flush here. So again, you're going to open this package sterilely so you're not touching this part of it. I'm going to carefully connect those two pieces. And if you've been in sim with me, you've seen kind of how I tell people to do is actually pull back on the plunger because it's kind of stuck there. It's how it's manufactured. So I pull back on it, loosen it up a little bit, and then you can very easily push the air out. If you push on it first, it's stuck, and sometimes it will kind of, especially if you have the cap off, it will go flying everywhere, or it'll just make a little bit of a mess. But again, not a right or a wrong, it's just kind of how I do it. I'm going to take my alcohol swab, I'm going to come over to my IV. I'm going to scrub this hub for 15 seconds at a minimum. Okay, so we'll say it's been 15 seconds. I'm going to pull this cap off. I can't set this down. If I set this down, turn my back on it, anything like that, I have to consider it contaminated, and I need to swab it again. So if you swab it and then set up your syringe, you're going to have to swab it again. So I just recommend swabbing it right before you're ready to do your flush. This goes right into the end, and I'm going to very slowly and gradually flush. Minimum of 3 to 5 milliliters we flush IVs with, so you don't often have to do the entire 10 ml syringe. You're looking to make sure that the IV is not infiltrated, there's no phlebitis. So infiltration presents as kind of cool edema around the site. Infiltration is going to be more of that warm redness that kind of streaks up the arm. We certainly don't want to see any of that. I'm looking also at what gauge my IV is. So right now I have a blue IV in that tells me that's a 22 gauge IV. A pink IV is a 20 gauge, and a green IV is an 18 gauge. Those are the three most common. Okay, Ms. Smith, your IV looks good. You'll ask your patient if they experience any burning or pain while you're doing that. That also might indicate the fact that their IV is not good any longer. So at this point, you guys would need to figure out your next three skills. So you're going to have to do med pass. Everyone's going to have to do med pass. Along with that, you're going to have two different skills. So everyone's going to get two different skills. They could be things like restraints, dressing change, IV, secondary IV, anything related to oxygenation. So putting the patient on oxygen, any type of oxygen delivery device, incentive spirometer. It could be PPE, so that could be one of the skills, and that's a skill obviously that you would have to demonstrate right from the get-go before you go into your patient, because of course we know that needs to come on. So we would be looking for you to be putting that on and taking that off appropriately. Can't think of any others. Wound care. Can't remember if I mentioned that or not. So at this point then you would go and determine, okay, what do I want to do next? I have meds to pass, I have a dressing to change, and I have restraints to put on. And you would go about doing those three skills. Okay?